Wear gloves as appropriate. If you are removing heavily soiled undergarments, for example, you must wear gloves and appropriate protective clothing. Number 5, don't forget to inspect the resident's skin while dressing the resident. Note any changes and report them to your supervisor immediately. Number 6, work smart. For example, if a resident has trouble standing up and getting back down, it is easiest to pull their underwear and slacks up at the very same time. Number 7, put clothing on the weak side first if the resident has any trouble with one-sided weakness. Let's watch as our caregiver assists a resident who has a weakened arm. As you will notice, she gathers the jacket sleeve up in her hand so that as she begins on his weakened side, it easily glides over his hand and wrist. She pulls the jacket sleeve up and over his arm and shoulder, and then brings the other side of the jacket around. Before assisting on the other side, she will place the weakened arm in the resident's lap so it doesn't simply dangle next to him while seated in the chair. The resident is then allowed to place their strong arm in the sleeve. You will note how she carefully brings the jacket around, making sure that it is not bunched up or uncomfortable behind the resident. Now let's look how we would remove a jacket when the resident has a weakened arm. The caregiver will begin on the resident's strong side, removing the jacket from the strong side first, then going over to the weakened side and pulling the jacket down the arm, gathering it as she goes, and gently pulling it over the wrist and hand. Many residents will require assistance with shoes and socks. When assisting the resident, always gather the sock together, easing it first over the toes and heels and then up the leg. Slip-on shoes are always easiest. Again, some residents will require the shoe be applied, but many, as you watch with our caregiver here, will allow the resident to assist in putting the shoes on. Again, remember that independence is so very important. Allow the resident to do as much for themselves as they possibly can. We will want to find out how much assistance will the resident require with the bath. Some residents will be fully independent with the bathing process. Other residents will require simply a transfer in and out of the shower, or perhaps a little help with bathing hard-to-reach body parts. On the other hand, some residents will require the full performance of the shower or bath for them. Before you even bring the resident into the bathroom, you're going to want to make sure you're ready to give the shower. First and foremost, temperature of the bathroom. Is it warm enough for the resident? Now this is a question you have to ask yourself. Is it warm enough for you or warm enough for the resident? Remember, they chill easily and appreciate a nice warm bathroom area. You're going to want to make sure you have all your supplies right here so you don't have to leave the resident alone at all. So, for example, the resident's favorite soap. You'll want to make sure you have plenty of towels and washcloths. If there's any little cleansing devices the resident particularly likes to use, you'll have those. And don't forget, you'll also want to have clothing available for the resident to wear after the shower. Now you'll want to make sure the shower area is ready. So for example, while the shower curtain is lovely, that's going to be in our way as we assist with the shower. So we'll want to push this out of the way and tuck it so that it doesn't pose a safety risk as we bathe the resident. The bath area must be safe. Now the flooring in this shower area is specially treated with a non-skid surface. However, if it were not, you'd want to make sure a rubberized mat was down so the resident will not slip in the shower area. We'll want to make sure we pull down the seating for the resident making sure it's locked into place. Additionally, the mats here on the outside of the floor will protect the resident as the resident steps outside of the shower. Once the resident has been safely transferred into the shower and is seated comfortably, you'll want to adjust the water temperature. Always point the water away from the resident so none of it splashes on them until you're sure you have a safe temperature. Once the water temperature feels good to you, allow the resident to put their hand up to make sure it's a good temperature for them. It is also important that we look at the resident preferences. Do they like to bathe in the morning or the evening? Do they like to wash their hair while they're in the shower, or do they prefer to go to the beauty salon? Do they like to get dressed immediately after the bath or shower, or do they prefer to lounge in a terry robe for a while? All of this is important so that we can personalize and individualize the care for the resident. For the protection of resident dignity, we have chosen to use a mannequin to demonstrate bathing and perineal care. We are going to demonstrate giving a bed bath, as many of the same techniques will be used when showering a resident. When bathing the resident, as mentioned earlier, we want to gather all necessary supplies first: towels, soap, basins, and so forth. If the resident has a hospital-type bed when giving a bed bath, always adjust the height of the bed to a comfortable level. Provide for privacy. Make sure the resident is well covered with towels or a bath blanket. Whenever bathing a resident, we will use gloves to protect ourselves, as well as any other necessary protective equipment. When bathing the resident, you may make a mitt from a washcloth so that the resident is bathed comfortably. When beginning to bathe the resident, cleanse the eye areas first, working from the inner corner of the eye gently with outward motion. Many residents do not wish to use soap on their face. They prefer just plain water. Always ask the resident what they prefer. The facial and neck area is cleansed next. Be sure to watch for folds and crevices in the skin, under the neck and around the chin area. After cleansing with soap, you will want to thoroughly rinse the area. Engage the resident in pleasant conversation as you're providing the bath. Use a nice, warm, clean towel to gently pat the resident dry. Never use strong or excessively vigorous rubbing motions when bathing the resident. You will then proceed to the shoulder and arm area. When giving a bed bath, you would expose this area by moving the towel back. In a shower, you would simply move on to this area. Use gentle motions as you cleanse the shoulder, arm, hands, and axilla area. Again, rinse carefully after using soap. Now, many residents will be able to perform this part of the bath or shower on their own. Gently pat the area dry with a towel. You would proceed and do the other arm area. After the arms and shoulders are clean, we're going to cleanse the chest and torso area. For female residents, you will want to gently lift the breast and clean very carefully under the breast area. After rinsing, you will pat dry gently. Now remember, all the while giving a bath or shower is a good time to watch for any changes in the resident's skin integrity. You will want to report these changes immediately to your supervisor. Always cover the resident, never exposing more than what is necessary. After cleansing the chest and torso, you will clean the leg areas, moving all the way down to the feet and heels. Be sure again to watch for folds and crevices in the skin and to cleanse well. Carefully inspect the heel, feet, and toes as you are bathing those areas. Some residents that are able to independently bathe the upper part of their body during a shower will require that you bend down and assist with the lower leg and foot area. Gently pat dry. Again, you can see she is very carefully inspecting and drying well between each toe. You would then proceed to the other leg and foot area. In a bed bath, we will then help position the resident on their side to clean their back and upper shoulders. Notice how the half bed rail is placed for safety. Again, the back is gently washed. During a shower, the resident can lean slightly forward on the shower chair as you gently clean their back and upper shoulders. Again, this is a good time to inspect for any skin changes. Of course, during our bed bath, we are drying each section as we move along. In a shower, we would of course not dry until completely finished with the shower. We then move down and clean the buttocks area. Sometimes it is necessary to very gently lift the skin to clean carefully around the external rectal area. We will then proceed with perineal care. You will see this in an upcoming segment of the video. If the resident were showering as opposed to the bed bath, you can also very carefully drape towels around the resident to provide for maximum privacy while they're showering. You can see one towel is placed under each arm of the resident in front, while another towel is carefully draped over their shoulders. Not only does this provide privacy and preserve dignity, but it also adds a little extra warmth for the resident. What about toileting? Many of our residents will simply use the toilet independently. However, some residents will require reminders or prompting or even assistance to enter and exit and use the toilet appropriately. Some residents know when they need to use the toilet, for example, but need some help getting on and off the toilet. Some residents will even require assistance in cleaning themselves after they've used the toilet. You will also want to consider if the resident is incontinent. If you are told the resident is incontinent, you will want to make sure you understand what kind of briefs the resident uses. Do they like pull-up briefs? Do they use a full adult diaper type brief? Or do they simply manage with some small pads? When cleansing the resident's genital areas, whether during the bathing process or if a resident has awakened, for example, in the morning and has been incontinent of urine and feces, it is important to follow certain technique. Always practice good standard precautions using your hand washing techniques and glove use. Make sure that you have provided adequately for privacy. You will also want to make sure that a waterproof pad, also known as a chucks, or perhaps towels, have been placed under the resident's buttocks. You will want to make sure you have all of your supplies within easy reach, whether that will be disposable wipes or moistened washcloths or towelettes. Roll the resident onto their side and remove the soiled adult brief. If there is feces present, scoop as much of the feces as possible into the soiled diaper. Some residents may have some difficulty remaining on their side. You may need to use one hand to help position the resident while you are cleansing with the other hand. You will then use either your washcloths, you will certainly need more than one, or wipes to cleanse the resident. The cleansing motion should always go from front to back, especially on our female residents. Wipe with a towelette and put it in your disposal area. Take another towelette and continue wiping until the skin is nice and clean. You may need to gently pull up on the buttocks with one hand, opening the cheeks of the buttocks so that the rectal area can be cleansed appropriately. You may then allow the resident to turn onto their back once a fresh brief has been placed underneath the resident. It is often easier to place the fresh brief under the resident before allowing them to turn back on